Hi, I'm Dr. Sarah Dilworth. I'm at the Drake Center for Veterinary Care, and I'm going to be answering some questions about dog surgery.
Dr. Dilworth, what do I need to know before my dog has surgery?
So understanding why your dog is having surgery and what the surgery is going to entail, as well as what recovery time is going to look like, are some important questions to discuss with your vet.
Will my dog need lab work done prior to having surgery?
Yes, we require our patients to have lab work prior to surgery, primarily so that we can understand how safe surgery is or isn't going to be for some of those patients and understand their overall metabolic stability going into the procedure.
Does my dog need to see a specialist for their surgery?
Depending on the type of surgery would indicate whether or not we would refer them to a specialist. Certain things like orthopedic surgery, we do refer to a specialist. Some other types of emergency surgeries, we will refer to a specialist. And we here at the Drake Center can help determine which of those patients we would recommend sending to a specialist.
What will my veterinarian be looking for in the pre-surgery lab work?
So in the pre-surgery lab work, there's a few different indicators that we're looking at to understand how the anesthesia is going to be metabolized or digested. So there's a few organ functionalities that we look at. We also check their platelet count, which is the glue of the blood, to make sure that they're clotting appropriately and that there aren't any other significant abnormalities that would give us concern about their overall health that would put their anesthetic risk much higher, or that would make us change our plans for the procedure.
Who will be monitoring my dog while under anesthesia?
So here at the Drake Center, we have a team of veterinarian and technicians, and some of the technicians are registered veterinary technicians who have additional schooling and licensing and particular training in anesthesia, and they're the ones who are monitoring our anesthetic procedures.
How long will my dog need to recover after having surgery?
So some of the surgeries, it's variable as to what your dog will have done and how long it will take them to recover. The majority of soft tissue surgeries, spays, neuters, some of the wound repairs take about 10 days for full healing period. Some of the other oral surgeries, depending on the level of extraction, can be a week to 2 weeks. And then some of the more complicated procedures, some of the more drastic wound repairs, things like that, we can be expecting about a 2-week recovery.
All right, last question. How can I help my dog recover at home after surgery?
So one of the most important things is paying attention to discharge instructions from your doctor, which you'll receive after their procedure. And those instructions include information about medications that they may go home with, as well as diet that they need, and their activity level. So activity restriction can be really important in some of the healing processes, as well as whether or not they are going to need an e-collar or a cone, and how long they're going to need to maintain that, as well as any follow-up that would be indicated afterwards for their procedure. So if you have any questions or concerns about dog surgery, don't hesitate to contact us at the Drake Center.